Hello, everyone, and welcome to the AFTD educational webinar, The Speech-Language Pathologist Role in FTD Care. I'm Esther Kane, AFTD's Director of Support and Education. On behalf of everyone here, thank you for joining us today. A few housekeeping items before I introduce our guest presenter. Please note our audience will be muted for the duration of the presentation. This helps to keep the background noise to a minimum so that everyone can hear the presenter clearly. If you have any technical issues, please write a message in the questions box, and AFTD's own Lauren Gaudier will try to address them with you. We will be answering questions at the end of today's presentation. Please type your questions in the box as you think of them, and we will address as many as time permits. This webinar will be recorded and archived on our YouTube page with all our other educational webinars. Visit youtube.com/theaftd.org to find our webinar playlist. Before we get started, I wanted to highlight AFTD's 2021 Education Conference, which took place last month. More than 1,200 people registered to take part in the virtual conference, and I'm sure many of you listening right now were among the attendees. If you were not able to watch our conference live, most sessions were recorded and can be viewed at aftdconference.org. AFTD will be hosting 2 Driving Hope golf tournaments this August. These are great opportunities to hit the links while supporting AFTD's mission. Tournaments will be held in the Denver-Boulder metro area and in Nassau County on Long Island, New York. Visit the links on screen for more information, and if you have questions, you can email AFTD's Special Events Manager, Bridget Graham. We are looking forward to the return of races later this year. AFTD will have a presence at all of the races listed on screen. If you want to raise FTD funds and awareness while enjoying the great outdoors, then look no further. Learn how you can join the AFTD team by visiting our website, and again, email Bridget Graham with any questions. At this point, I would like to introduce our guest presenter. Becky Khayum is a speech-language pathologist who specializes in providing person-centered care for people living with different types of dementia syndromes. In 2009, Becky co-founded Memory Care Corporation, a therapy company specializing in providing care for families coping with dementia in the Chicago region. In 2020, she co-founded Cognitive Concierge, where she currently works with clients across the country as a cognitive ambassador. Becky previously served as an adjunct instructor at the Northwestern Museum Center for Cognitive Neurology and Alzheimer's Disease, where she collaborated on research initiatives in the areas of telehealth and primary progressive aphasia. Welcome, Becky. We are very glad to have you here. And now I turn things over to you.
Wonderful. Well, thank you so much, Esther, for the warm introduction. And thank you to the AFTD for, it's such an honor to speak with all of you today. I'm just going to go into presenter mode here. All right. So as we mentioned, we're going to be talking a little bit today about really how can a speech-language pathologist help those of you living with frontotemporal degeneration. And I think it'll be really important for us just to look at a lot of different strategies today, ideas that will help both with communication, but also managing behavioral challenges. So I'm excited to share that with you. And also another side note, I know we have many of you here that are living with FTD or perhaps care partners of FTD, and I will be speaking directly to you, but I know we also have a lot of healthcare providers here, and so certainly I think this information will be helpful to you as well. Let me move on to my disclosures very briefly here, financial and non-financial, and we'll dive right in. So for our agenda today, we're really going to start off with saying, okay, who is a speech-language pathologist and how can you help? And how do I find a speech-language pathologist in my area who understands FTD? And also, what are some reimbursement considerations for speech therapy? And then we'll move into communication interventions, some ideas, and also behavioral interventions that a speech-language pathologist may work on with families who are living with FTD. And I also may use the acronym SLP instead of saying speech-language pathologist. And just so you know, speech therapist, speech-language pathologist means the same thing. So no worries if you use the shorter term. Also, before we get started, I wanted to make sure we all are on the same page in terms of nomenclature as related to FTD, because I know it can get quite confusing at times. So frontal temporal degeneration really has three main categories of symptoms, which define the different syndromes: language, behavior, and motor difficulties. So one dementia syndrome that really affects language is primary progressive aphasia. And so that's where language and comprehension, reading and writing are getting worse over time. With the behavioral variant of FTD or BVFTD, we're really looking at changes in personality and behavior, or are the initial symptoms that we're seeing that get worse over time. And then some individuals have more motor symptoms. So with primary progressive apraxia of speech, which is the motor planning for speech, cortical basal syndrome, progressive supranuclear palsy, and the ALS frontotemporal spectrum disorder. And of course, these motor syndromes may also have symptoms, individuals may have symptoms that do impact language and behavior as well. So what is a speech-language pathologist? Who are we? And I always say that a nice way to think of us is that we cover anything from the neck up. So we work on swallowing, we work on speech and articulation. You may think of speech therapists in the school-based settings. But I think something that a lot of people don't realize is that we really work with all different areas of cognition, meaning not just language and comprehension, but also memory loss and problem solving and sequencing, initiation, behavioral challenges. And of course, we work on aphasia, a language impairment, in different voice disorders as well. So some people living with FTD have problems with speech intelligibility, especially with the motor syndromes, and we may work on voice and speak articulation with those people living with a motor syndrome. And I always like to differentiate speech-language therapy versus occupational therapy, and just to highlight that there are definitely some overlaps between the two different types of therapists, and it's so important to work as a team. I love working with my fellow occupational therapists and physical therapists, and we really enjoy collaborating together on the different goals. Where would you find a speech-language pathologist? We're really across all settings. So we're in acute care, subacute care, so that would be really rehabilitation after you're in the hospital. We're in outpatient clinics, we're in home health. We see people in independent living and assisted living communities. We're in memory care communities, and sometimes we'll also work with people who are on hospice. So what are some barriers in FTD care for when we're thinking about speech-language pathology? And really, speech-language pathologists in graduate school, we're really a jack of all trades a lot of times. We learn about children, we learn about adults, and then we go to different settings, and we really become experts in terms of the clients that we're seeing in that particular setting. And so some speech-language pathologists may have worked with a lot of people who have FTD, but others may never have worked with someone with FTD. And there are certainly geographic barriers to accessing specialists, especially if you live in a rural region. A lot of times the SLPs who have high specialties in a certain area, particularly FTD, maybe in more urban areas where you find a lot of the larger Alzheimer's disease centers and memory clinics. So that's certainly a barrier. We also don't have a lot of training in graduate school specifically on FTD interventions and how to document for insurance reimbursement. We just cover so much in grad school. It's, we really have to do specific continuing education seminars to learn these types of things, and not every SLP will have taken those. You might say, okay, well, maybe with telehealth, right now during the pandemic, I've been able to access a specialist, even though I don't live near them, via telehealth. And that's great right now, because during the pandemic, there's been a waiver where Medicare and other insurance companies will reimburse for telehealth, but that is slated to go away after the public health emergency ends. And so certainly at that point, we'll be lobbying and advocating for ongoing reimbursement for telehealth services, because especially for families like you who are living with a relatively rare diagnosis, it's critical that you have access to specialists in that area. Okay, so let's talk about tips. How can you locate an SLP in your region who will be a good fit for you? Well, first, you do need to check your insurance to see, as you're doing your research, you're finding different local options for SLPs. Who's in network? What restrictions does your insurance company have? So I know a lot of you living with FTD, maybe under 65, and you don't have Medicare yet. Medicare doesn't have restrictions on in-network providers. You can really think about, if you can't find a good fit locally who's within network, you can file an appeal or grievance for an out-of-network provider, and sometimes insurance companies will then allow you to see someone who's out of network. I always say, start off, if you have a local Alzheimer's disease center or memory clinic in your region, contact them first, see if they can recommend an SLP for you. And then lastly, let's say you can't find any recommended SLPs, then it's important just to call around and ask to speak with a local SLP prior to scheduling your initial evaluation. And here's some questions you could ask to see if this person might be a good fit. I'm just asking if they have any experience in working with people living with FTD. You might want to state your particular diagnosis, if it's PPA or BVFTD, and ask, do they feel comfortable working with this diagnosis? And some may say no, and that's okay. It just means you ask them if they know of someone else they'd recommend, or you continue your search. I'd ask what types of interventions they typically use. And certainly during the presentation today, you can see what types of interventions are out there, see if they align. Do ask if they work with families to create person-centered goals, because that's so critical that the goals are personalized. We'll be talking today about a life participation approach to care, and any SLP who's aware of this approach will likely be a good fit, because it means that they're aware of how to really cater goals and strategies for your particular needs to participate in life activities and manage different challenges. And then another question is, are you willing to learn more about FTD interventions if I provide you with some resources? And so perhaps this, this presentation, other articles and resources. And if they say yes, that's, it's a great sign. And then overall, just, kind of see over the phone if the SLP's personality seems to be a good fit. Does it seem like they're willing to be creative and collaborative to help you meet your goals? And if you don't feel like it's going to be a good fit, continue your search. And hopefully that will guide you in terms of finding a good fit. Just some tips for insurance reimbursement. So a lot of times, SLPs, or I've heard from families that SLPs aren't sure how to continue to work with families, perhaps longer than a month or a few sessions, because they'll say, you have a condition that gets worse over time. I don't really know what else I can do for you. I can't demonstrate progress for insurance. I can't show improvement on standardized tests. And so they'll discharge you. And so here's some tips you could give your SLP in terms of how they could document so you can get reimbursed, because they really can. It's just knowing how to document the services. So first of all, a lot of SLPs may be using standardized tests that just look at what's wrong with you. And really it's important that they're looking at other types of outcome measures that are out there that look at when you're reporting how you feel about your outcomes. And there are a lot of measures that look at that. And really just talking with you during that initial evaluation and creating goals that are important to you, those goals will demonstrate progress, which can then be submitted to insurance. The goals need to be realistic, and we'll talk about how to make those goals realistic as we talk about different interventions today. And the goals should be functional. It should be about things that you're doing on a daily basis. It shouldn't be about worksheets or that you can name a certain number of animals in 20 seconds, right? It's critical that care partners, or if you're living in a residential community, staff members need to be involved in the treatment, in the evaluation, because it's working as a team where we're going to really see progress. And another thing that I hear a lot is that an SLP will say, well, the individual living with FTD doesn't really have any insight into their impairment. Therefore, I really can't work with them. And that's where we'll talk about it's really looking at the environment around the person and the people around the person, training them. And that's how we're going to make a difference and show progress towards goals. So those are just some tips you can share with your SLP. And now let's talk a little bit about what is that life participation approach? What is that? What is this buzzword? So increasingly, there's a movement, not just within the field of speech-language pathology, but within the whole medical world, and that's on person-centered care. And really not just looking at what's wrong with you. So if you're living with aphasia or you're living with other types of cognitive deficits, okay, we know you have those challenges or those impairments, and that's in that bottom circle there. And this is the AFROM model that was developed by Kagan and colleagues in 2008, just to reference that. And so the other three circles here really are looking at how your impairment is impacting your daily life. So the environment you're communicating in, how does it impact your personal identity and your emotions and feelings? How does your deficit really impact your ability to participate in different life situations and meaningful activities? And so a speech-language pathologist needs to be looking at all of these different things in order to provide the best care possible for you and your family. So let's start off with talking about communication interventions. And while let me start off by saying that certainly people living with primary progressive aphasia, of course, language and communication is the most impacted, but people living with other types of FTD, behavioral variant, motor syndromes, certainly can have or develop communication difficulties over time. And so all of these different communication strategies can be used across the different FTD syndromes. So one way, I just thought of this kind of analogy today, actually, and when we're thinking about navigating through FTD, I want you to picture this circle in the middle as kind of a steering wheel. And I like to think of 4 different areas that we might use to navigate through your challenges. And so the first area is really communication partner training. So really making sure both the person living with FTD, but also the communication partner or care partner understands the diagnosis. And then we're educating everyone around us who also communicates with that person about the diagnosis and strategies as well. And really, communication partners need to know how much support, how much cueing, or a little ways you can help the person who has FTD, how much is needed, because we don't want to provide too much, we don't want to provide too little, and over time that level of support may change. So that's critical in terms of communication partner training throughout your entire journey. The other square below that on our steering wheel, I guess it's actually a pie piece, is psychosocial support. And this is something that a speech-language pathologist certainly may provide some counseling related to the communication difficulties. But if we're noticing that someone needs additional support, knowing whether it's the care partner or the person living with FTD, the burden that this is on you, the emotional impact, we will make sure that we refer you to a mental health professional who can provide specialized support for you. Other different areas of intervention on our steering wheel here to help us navigate. At the top there would be restorative exercises. Restorative means, can we restore anything that has been lost? And in communication, can we restore some of the words that are important to us? Can we help make comprehension easier? Can we practice different conversations to make them easier? And so that's where we'll be talking about a lot of different types of restorative exercises over the next few minutes. And lastly, down there, our last pie piece on our steering wheel are compensatory strategies. So we're compensating or going around the challenge in order to still participate in that activity or participate in that conversation. So we will be setting up the environment for success. We may use things like communication books and wallets. We may use high-tech communication supports or different visual aids. And so all of these are different things that we may use, but it's important to remember that every person will need a unique blend of these different strategies and areas on our steering wheel here as we're navigating. So as I was creating my steering wheel today, I know it got a little bit lopsided. I'm not the best with, of course, illustrations on PowerPoint, so ignore the fact that our steering wheel got a little lopsided here. But the point of this is that these different areas, these different pie pieces in our steering wheel will change, and they're unique for every person. So whereas someone may, when they're first diagnosed, they may want to work a lot on different language exercises, but at the same time, we're working on communication partner training, we're providing that psychosocial support, and we're also working on some compensatory strategy training. But then in a later time in the journey, they say, I don't want to practice the exercises anymore. I've worked on them for a long time. I really want to think about when I'm frustrated, what's my backup plan? I want to work on using my phone or my communication book to get the message across. So therefore, the different pieces of our pie on our steering wheel will change at any time, and they're unique to every person. So that's kind of the framework when we're thinking about communication strategies. And now I'm going to give you some examples of all of those different pieces of that pie, what different strategies might lie in those different pie pieces. And just as a reminder, we are going to have unique strategies for different communication environments. So I'll talk with people to say, where do you need to communicate? Of course at home, but are you in a golf group? Do you go to your daughter's house? Do you need to go to the bank, different places of worship, or go talk with your doctor? And the different interventions and strategies we'll use in those settings are unique. And so that's one important thing to remember. And then it's also important to really think about your social network. Social network means, who are all of the people that you talk with in your life, and who do you want to talk to? And who do you feel like maybe you used to talk to, but now you don't have that same relationship with them anymore. So that's another thing that we always want to identify. And if there's someone that you want to talk to more, or that you're having a lot of trouble talking to, we would make a goal to target different strategies specifically for that person. So when we're thinking about care partner, education and training, people will ask, well, who is my care partner? And or communication partner, right? And it's really, as we just looked at in that social network, it's everyone around you. Everyone can benefit from training, even though someone well, we may go into more training and give them advice on different communication strategies that are unique to you, versus someone we don't know very well. where, you know, the AFTD and other organizations actually have cards where you could just hand them to someone. If you're the server at a restaurant, a flight attendant, if you're taking you know, you're on a plane. And so this is another way that it's helpful to educate others about your condition. So let's move into now talking about, you want to do speech exercises or language exercises. And a lot of people will say, well, what should I practice? Should I work on brain games on my iPad? Should I do flashcards? What should I do? And so the first recommendation is, and research, you know, there's a lot of research looking at personalized words and practicing those. And initial evidence is showing that if you rehearse words and practice words, we can make them better over time. And if you continue to practice those, we'll keep those words strong. And so we definitely want to make sure we're focusing on words. We'll talk about scripts, conversations that are important in your daily life, and really thinking about how do you continue to participate in your desired leisure activities. You can see all these different examples below here in the pictures. And how do we work on vocabulary words or conversations, scripts that may help with those particular activities. So I oftentimes start off therapy with clients by saying, well, let's brainstorm different words by category in your life, you know, all different words that are important to you. And we'll create a little mini lexicon of words. So certainly mention this idea to your SLP, and they can certainly help you with this. Sometimes we'll use a simple grid to identify important words to help us in the brainstorming process. So people or places, and you can certainly go back and look at this presentation on the AFTD website. If you want to take a picture, you know, of some of these different ideas and templates, you're more than welcome to cater them for your own needs. And so then there are a lot of different ways you could then practice the words that you've identified. And this is really where you will want to work with this, with your SLP on what types of flashcards are best for you. So would it be a computer-based flashcards, or using an app on your phone like Quizlet to make personalized flashcards? The key here is that we're not just doing generic workbook pages that have words in them that aren't important to you. We want to take these words and make, you know, you can put pictures on the front and over practicing, okay, what is that plant that I grow in my garden? Oh, it's raspberries or cauliflower. And so maybe putting little cues on the front of the card, like this is the red fruit that I grow in my garden, or it starts with an R. Or if you, you know, have trouble comprehending, have someone say, you know, point to the raspberries, and work on recognition of that word. So that's where you'll definitely want to consult with your SLP on how to make different exercises. Another type of practice is a conversation script. And this is just the idea that we're taking a conversation topic that's important to you, and we're developing like a little script that actors or actresses might use, you know, similar to that, but simplified. And you write out what you would like to say, or it could be something you say a lot, like ordering the same food at a restaurant, or a prayer. It could be something that's seasonal, like what you're going to do for the holiday, or what you did last week on a family vacation, or playing golf, how you did on your last game. You can write them out, and then it's practicing them over and over again until that script becomes more fluent. So it can be on any topic. You know, this is just an example of, you know, someone who wanted to talk about their gardening, had some trouble with pronunciation. So we highlighted those difficult words. We segmented out the syllables for pronunciation, and she practiced that over and over again. And when she got together with her neighbors and her friends, she was able to say this script much more fluently. Just other examples, you know, if you're talking to family members on the phone or on FaceTime or Zoom, make a little script, you know, to ask questions to each of those different family members, and practice that a few times before the conversation. And then you can also just have the script sitting right in front of you during the conversation to help you with those questions. A lot of people will say that their loved one isn't initiating conversation. So we're sitting at the dinner table. He just never even asks us how we're doing or how our day was. And so you might just have a card that sits next to the table that a communication partner could write out. And it says, you know, ask Alex, your son, these questions. How was school today? How is soccer going? And you could just kind of point to that, give a little gesture. You know, hey, you might want to ask him some questions today. And so that can really help with initiation. You could write out different questions on different days. Another example of a script. So we talked about the pie piece of different exercises. That certainly isn't comprehensive for different communication exercises, but just some examples of what you could use. But now let's move into, this is more compensatory, right? What's our backup plan if we can't pull out the words or we can't get the message across just using speech alone, okay? And so think of a mechanic going to fix a car. If he or she only has just a couple of tools, they are probably not going to be able to fix the problem in your car. They really need a full inventory, a toolbox of lots of different tools. And you're using different tools in different settings and with different people instead of cars. So that's the same idea with communication and communication supports. So our goal is getting the message across. It doesn't have to be perfect, right? So we might use anything from gestures to someone who likes to draw to get their message across. We might use, we'll go through a lot of different types of low-tech visual aids. We'll talk about high-tech, and maybe using writing to help support people, or they may use writing to get their message across. Just different considerations, of course. High-tech versus low-tech supports or paper-based supports. Some people just want words on their visual aids, and others really benefit from having pictures. And some people want really small portable visual aids, and some want larger aids that have room for more items on them. And that's, a lot of people have, you know, lots of different types of aids of different sizes, high-tech and low-tech. You just need to work on this with your speech-language pathologist to determine what combination of supports are best for you. Just some examples. This is a communication wallet. You can just make this with different, again, going back to that list of words and conversations, scripts that you've created, you can put those on index cards, PowerPoint if you want to go high-tech, 1 slide per page, print it off 6 slides to a page. You can then laminate them and cut them out if you'd like. A really helpful app if you want different visual aids with pictures is an app called Pic Collage. You can easily insert your own pictures or Google search, if it does a Google search for you of different pictures. And you would work with your SLP to determine for your needs what is important in that visual aid. It may not just be words that you need to communicate. It may also be different sequencing aids, right? So if you're having trouble with trying to figure out that Keurig or sending an email, you could take a picture of each step and then put captions next to it. And that's another example of a visual aid. Going back to this garden idea, you know, thinking about, you know, we could take pictures of the garden and then put them into our communication book, have sentences as well to practice. That would just be one last example of kind of a low-tech communication book. You could put it in a binder, you can post them up around your home, or you could carry the little communication wallet in your pocket. But let's talk for a moment about high-tech supports. High-tech is not for everyone. I've had some people where they are living with FTD and they want to use high-tech, and they're great at using high-tech. I've had others that they'll use high-tech communication aids, but their care partner really initiates it and helps pull it up and points to it. Speech generating devices, the same idea. Sometimes they may be covered by insurance and you're working as a team with your communication partner to program that device and use it. But just the idea that you may want to take that same information that you've developed and put it in the notes section of your phone. You want to make sure you can order your favorite martini or beverage at a restaurant. just other ideas of high-tech apps and things that may be helpful. There are talking photo albums. A great app is called the Story Creator app. You can insert pictures, videos, and captions, and you could record this, practice some scripts, right? And then record it in order to tell a story about a recent vacation, about your family, about your occupation. It's something you could just share the link with others or pull it up at book club, and that will help you to get the message across. High-tech communication supports can be unique to everyone and unique to the activity. So if we're talking about gardening and we want to talk to our neighbor about what's in our garden, we may take pictures of our garden and just have it in our photo stream on our phone and use that to communicate. Some people have created Pinterest boards about their favorite items in their garden, and they pull up Pinterest and show different pins on Pinterest. We talked about using a collage making app to create a collage and store that on the phone or print it out. There are different apps that may relate to your topic. Plant Snap is one where you take a picture of a flower and it pulls up the word. It recognizes it, and you may use that to help pull out a word. So lots of different apps that you can get creative with. But the important thing is, with any of these different types of communication aids, whether it's high tech or low tech, we want to integrate them into meaningful activities. So if you wanted to talk with family members or do activities of family members, intergenerational activities, volunteering in a classroom, with students, you could think about how to use that vocabulary in different types of art activities, music activities. This just happened to be more garden, plant-related activities. So that's the goal, is to work in the vocabulary into different meaningful activities. Moving on as we kind of wrap up talking about communication and working in to our behavior segment. Really, it's important when we're thinking about comprehension with, aphasia is not just getting the message out. It's also getting the message in, right? So when others are talking to someone living with FTD, they may have trouble understanding the conversation. It's not a hearing problem. You don't need to speak more loudly. You don't need to use a childish tone. But here are some things you can do to help with helping that language center of the brain to interpret the words that they're hearing, so it doesn't sound a bit like a foreign language, to the individual with FTD. So you want to modify the environment. You want to eliminate distractions, turn off that TV, turn off the music in the background, really speak face to face, lots of eye contact. If you're going to a restaurant, pick a quieter restaurant, sit in the corner. Have the individual with aphasia face the wall so they're not looking at everything going on behind them. Really think about when rather than talking on the phone and only having audio, think about maybe using FaceTime, Skype, or Zoom versus the phone, so you have the visual. Care partners, communication partners, you need to change the way you speak. So simplify your sentence structure and repeat as necessary. You may need to slow down a little bit. Again, don't use a childish tone, just slow down a bit, and use lots of nonverbal cues like facial expressions, tone of voice, and gestures. But one thing that I think a lot of people don't use and maybe don't think about using are written and picture cues. So if someone has trouble comprehending just when hearing you speak, you really want to use other supports to get the message in. So you may get a notebook, or I love this boogie board, where you carry it around with you. And when you're in a more complex conversation about the daily schedule, about, heaven forbid, politics, you can be writing down different key points as you're going along, or in a group, write down key points, and that way it'll help the person with aphasia to better comprehend the flow of the conversation. If it's a single word recognition problem, oh, can you go grab the ketchup out of the refrigerator? Wait, ketchup? What's ketchup? I'm trying to think of that. Just pull up your phone, say, Siri, picture of ketchup. Show the picture, and a lot of times that will immediately help people comprehend what that word is. So use lots of visual supports to supplement your speech. Okay, so again, I'll take questions on all of those different just ideas. I give whole day workshops on these topics. And so this is just a glimpse at how an SLP may help someone living with FTD who has communication difficulties. But in the last 20 minutes, I want to talk a little bit about what can we do to help individuals living with BVFTD, but also with people living with FTD, other syndromes of FTD, who may also have different changes in personality and behaviors. And so we're going to be talking a little bit about all of these different areas here and how an SLP may help, certainly collaborating with everyone around that person, not just the SLP working in their silo. So again, how can we help the person, living with FTD if they have no insight, right? And so really I always remind care partners and people living with that person with BVFTD, they can't change. It's very hard for them to change. We must be the ones to change with our communication patterns, using visual supports, modifying the environment, and adapting activities, and really taking advantage of people's intact strengths to compensate for the weaknesses, and always preserving life roles. And we'll be ending our discussion today talking about different life roles. The bottom line is we cannot use a cookie cutter approach when we're working with behavioral challenges. Everyone's unique. Everyone's going to respond differently to the different strategies that I'm mentioning today. I do a lot of trialing, and we're modifying interventions over time. And I know this for you living with BVFTD family members, I know how challenging this is, that it's unpredictable. And that one day this works, and now 2 months later, that strategy we're using doesn't work. That's where working with the speech-language pathologist and occupational therapist can make a dramatic difference, because we're there with you and we're helping you to brainstorm new strategies to help out with these new symptoms that come out of nowhere next week. So again, really SLPs will do care partner support and education. And a lot of times it's just changing that expectation, right? It's realizing that the changes in personality and behavior are really a result of physical changes in the brain, and it's unintentional. They're not trying to do these, behaviors to annoy you. And it's trying to anticipate and prevent the behaviors from happening, rather than confronting the person, correcting them, after it's happened, or trying to convince them that they have that behavior. And then I know a lot of questions about, okay, my loved one's in memory care or long-term care, and the staff just doesn't understand FTD. This is a whole day presentation just on that topic alone. Believe me, myself, many SLPs and other healthcare professionals are actively working on how can we help in memory care communities. Caregivers are undertrained and underpaid. They have so many residents per shift. And so more and more research is coming out on how we can best train caregivers. And the bottom line is you sometimes have to be that squeaky wheel if your loved one is in a memory care community. They have to have constant advocacy to help, with their needs, and really utilize that therapy team and the social worker who's in that community. So let's just talk a little bit about anosognosia. That's where the individual doesn't understand that they have an impairment, right? Or different changes in personality. And we talked about we don't want to try to convince them that they have these symptoms, right? And so one thing that I'll use sometime to really help with people who may not, and this can be a little bit with whether it's anosognosia or not understanding, like I need to take a medication to help with my impairment, or I need to stay with this companion who's here while my care partner needs respite to go to the grocery store. This is just an idea that we use for a lot of different areas, and it's called simulated presence treatment. So this is the idea that we're using a recording, we're using a video, and we're replaying a video of familiar people or someone in a position of an authority, like a physician, and we're trying to elicit a desired behavior. So we have used videos where it's a communication partner, a spouse, redirecting someone when they're agitated. So for example, one communication partner said, Every time my neighbor comes over to stay with my husband, and I go out to the grocery store, he tries to leave and follow me. And he gets really combative, when they say, no, you can't leave the house. So on the companion's phone, they just recorded a simple video of his wife saying, Bob, I'm just running out to the grocery store. I'm going to get your favorite treat, some ice cream. Barbara is she's our neighbor. We're going to go watch, she's going to watch your favorite movie with you. So why don't you go do that? And it worked really well every time he tried to leave the house. Sometimes, using a physician to take medications. So, just recording a video saying, you really need to take these medications every day, or if someone doesn't want to bathe, you'll get a rash if you don't bathe. And so when you go and visit your physician, you can ask them if they would mind trying the simulated presence treatment, see if they're on board, get the video right then when you're in the appointment, and you can see if that helps. This is just an example. If you can't get the video, you could create like a visual aid with kind of a letter from the doctor with their, picture, and then get permission from them to either, kind of sign their name or have them sign it. Of course, get permission from them to do this, but I found that this can help really well too. And then another area, we don't have sound today in our videos, but I'm just gonna describe to you what is going on in this video. In memory care communities, we're trialing where we have a smart tablet, an iPad at the nurse's station or at the front desk. And when individuals come up asking where their spouse is, where their family member is, or saying, I need to go out and do this, where am I, why am I here? They'll record videos of loved ones speaking to them, and they're on the iPad, they'll play it, and it will comfort them by saying, you're staying at Spring Meadows. It's a place where they have a lot of different art projects, and that you're really interested in. They have different lectures on art as well. And I can't be with you right now, but all of your room and board and meals are already covered. And I'll be looking forward, to seeing you soon. I can't wait to hear how that art activity goes. So it's really redirecting them, comforting them. Again, more research needs to be done to see if these can help, but that's just another example of simulated presence therapy and how we can redirect if someone has poor insight. So a lot of times people will say, they just seem so apathetic about everything. They just don't care. They don't recognize emotions. There's really poor initiation of activities. They just don't want to do the things they used to do. So there are a lot of different things we can do to help with this. And one thing is establishing a really consistent routine. So even though people with BVFTD don't have memory loss, I just call this a memory station because I use it with everyone, no matter what diagnosis they have. And it's the idea that we have a memory station where we have all sorts of tools that have the daily schedule written out on a dry erase board. It may have the general calendar there as well. And anything else related to important tools in daily life. But the important thing is that on that dry erase board, you are having a consistent routine every day, and then you're inserting activities that are maybe that person are meaningful to that person. If someone would be living with BVFTD wants to do the same activity over and over and over again, watching the same movie over and over again, I always say, if it's safe and they enjoy it, that's okay. But if you also want them to get up and exercise, just program that daily walk right after breakfast every day. Have it at a consistent time, and usually that routine helps with that person living with BVFTD to integrate those other things into the schedule. Other items that people put at the memory station, maybe different communication supports, organizing important items all in one place, a clock just to remind, of the time and date, different items that may be helpful. So that's just one example of helping with that, the apathy or lack of initiation. There's certainly many other strategies, that we just don't have time to talk about today. So I know sometimes, there can be very impulsive behaviors or perhaps aggressive behaviors. And so what the SLP can do, working as a team with others, is looking at triggers through behavior logs. And then, of course, working on care partners, staff training, and environmental modifications. A behavior log is really simple. You can use this at home and present it, to your SLP and your occupational therapist if you're working with them as well. And you'll really want to look at the date and time of the behavior. What is the behavior? Where are you when it happens? What's the activity? And who's around the person living with FTD? And we can start to see patterns. And if we see patterns, again, it's all about predicting when a behavior is going to occur and in what settings it's going to occur. And then we can adapt strategies to try to, let's say it's shoplifting at the grocery store, right? Well, either A, we find someone to do a meaningful activity with them at home while you go to the grocery store. But if you need to go to the grocery store together, can you give them the grocery list? And their job is to be holding the grocery list and circling things that they would like or crossing off things as you get them. Give them some activity to do so perhaps they're not as tempted, to put that candy bar in their pocket. So again, we're looking at how to anticipate behaviors and then coming up with strategies to redirect behavior. So sometimes families will, really have a hard time with compulsive or perseverative behaviors, maybe OCD behaviors. Again, this is going to be very, very individualized, but just some general strategies we may use. You'll hear me say over and over, we're modifying that environment. So again, we're really, if someone's overeating, we're putting all of these sweets in the home kind of in a hidden place and only using them perhaps as a reward, or at a certain time of day. If they're roaming in a particular path every day over and over in that path, we may be making sure that we're moving rugs and furniture that may be a hazard. Really in residential settings, especially kind of these perseverative, loud behaviors, I know can be a challenge because they're really disturbing people around them. And again, people working in long-term care a lot of times don't have training in FTD symptoms, and they're used to working with people who are living with Alzheimer's dementia, and they simply don't know how to help. So we would really be working at, okay, is there a space where if someone is, has kind of a disruptive behavior, that they could go that's a little bit away from other residents. We may, really, I think it's important, as I mentioned before, what other activity could we introduce to redirect that behavior, and so I'll show you in a moment, if it's someone who's like rubbing and clapping their hands a lot, well, maybe if we give them a piece of wood and some sandpaper, maybe ask them to help sand that piece of wood. I mean, we trial so many different things that would be a replacement for that other behavior. And also a lot of these different perseverative behaviors come and go, and a new one will come up and it'll go away. And so it's a lot of trial and error. So now let's talk a little bit more about establishing roles. And this can be for anyone, of course, living with any symptoms, whether it's communication, or behavioral symptoms, motor symptoms. The important thing is that we're identifying what does the person enjoy doing? What did they used to do? What was their life role? That's still their life role. And how can we make sure they can still, in some modified way, participate in that life role, whether it's at home, and I have some pictures from a memory care community. So there's been more and more research coming out that's called Montessori for aging and dementia. And you think, okay, Montessori, I've only heard that, in use for children, but the concept of Montessori can be applied and is growing support from research for people living with different types of cognitive impairments. And the idea is that we're setting up the environment with the correct tools to complete whatever that activity is. And then we're inviting people with a visual aid to participate in that activity. So if someone really enjoys scrubbing the windows or sweeping, we need to have those materials set out with an invitation with this visual aid to actually participate in those activities. And I want to thank, this is a memory care community in Oak Brook Terrace here in Illinois, Terra Vista of Oak Brook Terrace. They graciously have allowed us to use some pictures in this presentation today. So sometimes we'll identify household activities that they may want to participate in. Other times we'll use, you know, we really have tried a lot of different things. Okay, create a greeting card. I think this one was kind of a fail because our writing utensils all ended up disappearing at the end of every day. So again, it's a little bit of trial and error. Sometimes we'll do different laundry activities. Again, with perseverative behaviors, sometimes doing something over and over again may be rewarding for that person. So please help fold the laundry, the clothes, and setting that basket out and inviting them to help. And we talked a little bit, again, it's, you know, not just looking at household activities, but it's looking at interests and hobbies. So if someone loves work, you know, doing woodwork, well, how can we still do that in different environments and with some of the challenges? So having a station set up with different types of wood, different textures, sandpaper, other tools that may be used to help, you know, with creating simple wood, you know, objects or whatnot, and that invitation to help do that activity. Just other examples, you know, with music, if they, you know, enjoy listening to music, you know, create visuals with all of their favorite records or CDs, or nowadays it's the Bluetooth, right? On the Pandora or whatnot. You can really pull up any song from any genre. It's really nice. So again, inviting them to tell you what kind of music they might want to listen to and then pulling that up. Just more examples, you know, we had a pastor one time in a memory care community who really liked to pray for people. And so we had family members from the community, his family members, other residents, we had a lot, we gave them all index cards, and if they wanted to, they could write things that they wanted him to pray for. And we just put it in a big basket in his room with this instruction, and you know, over and over again each day, he would complete those prayer intentions, and that was meaningful to him. Another individual we worked with, or actually I've done this, but Natalie Douglas, my colleague, Dr. Douglas, used this intervention with someone she was working with, and it was the idea that someone in a memory care community didn't really want to participate in the different activities around the community, but they really liked photography. And so they got this simple digital camera, they practiced using the different buttons, color coded them with the occupational therapist. And the woman was able to go around and take pictures of the different activities around the building. They would print them out, and then she would, you know, design a poster board with those. So a really nice way to, again, focusing on life roles and interests and hobbies, we can still have people do these things and participate in these activities, but they may just need to be modified a little bit. Last example here, a woman who really loved to garden, and, you know, prior to joining a memory care community, certainly this could be done at home as well, you know, really just setting up a little garden in the winter or outside in the summer, and, you know, watering those plants every day. And then in this memory care community, she did like to talk to others about plants and gardening and horticulture. So we made like those science fair poster boards, made a poster board that the SLP worked on with her. And then 3 days a week, she was on the activity schedule and gave that presentation 3 times a week. And then certainly if she got sick of that presentation, they could, you know, make another presentation on another topic she might be interested in. So so those are just some examples, again, of how the SLP would work with everyone around that individual to modify the environment, perhaps using that Montessori approach to really help them participate in different activities. So that concludes the content for today. And I just wanted to post, there are many different free support groups, strategy groups out there. I'm certain all of you, you know, maybe, of course, know of these, and I love to share information. But just so to share a couple with you, at the National Aphasia Association, I do facilitate 2 PPA cafes each month over Zoom. There's the link to sign up for those. My company, Cognitive Concierge, we have strategy chats. So the different things that we talked about today, we go into depth on those and really talk about different strategies each chat. That's over Zoom as well. We have different chats for people living with PPA and care partners, and another one for care partners of individuals with BVFTD. And there's the link for that. And of course, the AFTD has many different support groups. Please do go to their website and check out all of those different support groups as well, 3 virtual support groups. And lastly, we'll be moving on to questions now. And this is my contact information. Please feel free, whether you're a healthcare professional and or a family member, individual living with PPA or any type of FTD, please feel free to email me or that's my office phone. Again, I think it's a mission. If we're all working together, we can really make a difference in helping families living with FTDs. So thank you so much, and we'll move now to the question and answer section.
Well, Becky, thank you so much for all of the valuable information. It is so much information. I think that everyone is just processing a little bit because there were so many useful tools that you provided in this presentation. So thank you so much. One question somebody asked is, when is the right time to bring in a speech-language pathologist during the progression of the disease?
Oh, that's a great question. So I find that I've worked with people, and again, certainly research is looking at this as well, but I've worked with people who haven't even gotten a diagnosis yet, and they're just starting to experience symptoms, and they're in the middle of that diagnostic process. And we already are working on different strategies before they even get the diagnosis. I've worked with people shortly after the diagnosis is made because it's, I feel like you get this diagnosis, it's overwhelming. You get, if you're at, perhaps a memory clinic or Alzheimer's disease center, if you happen to live, by one of those, I know they might give you a ton of different things, of tests and MRIs and neuropsych evaluations, and, they may have a speech language, evaluation recommended on there. I find that sometimes I can help people by sorting out, providing aphasia friendly, explanations for the different tests that they're going through, the diagnostic process. And if they're not ready to start working on strategies yet, that's okay. We'll hold off. We may work on just understanding what's going on and understanding the diagnosis and getting that emotional support before we even start on strategies. And so, we'll stop, and then 6 months later, we get back together and we dive back in. So I always say there's never really a time where it's too early to start working with an SLP. And then I also work with families all the way along the journey. There are always things we can do, as I showed you today, to help. And you never graduate, right? My colleague, Dr. Rogalski at Northwestern, always says, you don't graduate from speech language therapy. When you're living with FTD, you think of it as going to the dentist, right? Okay, I'll see you in 6 months. Let's come back, let's check in, or perhaps earlier than that if another struggle comes up. So that's such a great question.
Yeah, thank you. There's a lot of good information in there for people. Another big question somebody asked, which I think is really interesting, is that their loved one has lost the ability to have written communication with PPA. And is that common all the time?
Sure, that's another great question. And from the time standpoint today, I took out my slides on writing interventions. So the answer is yes. With people living with PPA, writing is very commonly impacted because it's a similar area of the brain that helps with writing to that language center. And so sometimes writing, is impacted through spelling and the spelling of words. Sometimes it's the grammar, right? You can't form the sentences. And sometimes it's just even trying to think about what you want to say. You can't think of the words very quickly and get them down on paper. There are many different ways we can help with writing, all the way from, I'll have some people pick up maybe they aren't able to write out the word, or they can't remember how to spell it, but they can say it. So they'll use Siri on their phone and they'll say, spell Oklahoma. And then, Siri does a great job of displaying that. Perhaps we'll have templates with words that, that you write frequently, or emails that, you kind of send out frequently, greeting cards. And there are things that you could use that would help support your writing if you're, needing the help. They also have a lot of great apps out there that can, Grammarly is one that you can download it, and it helps with grammar, spell check on both your phone, texts and whatnot, Facebook, and you can download it onto your computer for emails and whatnot. So just a couple of suggestions to help with writing.
We have another person who's asking, her husband has behavioral variant FTD, and he used to have a huge personality. Now he barely speaks, but all speech is appropriate. Should I be encouraging more for him to talk if he seems comfortable without? But his voice itself seems to be getting weaker. Is it time for a speech therapist?
That's a really good question. Of course, I'm going to say yes. I do think seeing an SLP would be helpful. And it's of course unique to everyone. But what I always say is it's hard to know sometimes. Some people truly really have severe challenges, and even they want to talk, but they can't pull out the words, right? And others appear to be, really challenged, but it's really more of an initiation issue, as you mentioned. So it's maybe have the language there, but just aren't initiating language. And so what I always recommend is finding topics that, they're interested in. And we talked about some of those communication book pages. Put together different visual aids that have to do with their favorite topics, or when you're going out with friends or whatnot, or with family members, and you may need to engage them actively, right? Well, hey, let's sit down, and I would love to talk about, remember that time we went to the Midwest, and we did this in Chicago. And sometimes then you may actively engage them in a conversation. As far as the voice goes, the weakening voice, that's certainly something where the speech-language pathologist could look at that more closely and see if there are any strategies to amplify the voice a bit if it becomes hard to understand. So that's another really great question.
So I have actually a therapist here, and she says that all of my patients engage in picking around their nails or nail bed during therapy. How can I troubleshoot that behavior while in therapy? Previously, I have asked the patients to hold something else in their hands, but so far that has been ineffective.
Yeah, no, that's a tough one. So that certainly is what we talked about, those kind of perceptive behaviors, right, or habits. And so for people who, it's not just during the speech therapy sessions, they're probably doing that at home as well, right? So we've done everything, when I'm working with family members, to find nail polish that there's like a clear nail polish that kind of or they're not biting the nails, sorry, they're picking at the nails. I mean, we've done everything from, sometimes we'll kind of put band-aids over several of the fingers to remind them. Usually for me, it's trial and error with giving them something manipulable or sensory object. For most people I've worked with, if I might have to trial 20 different things, and I usually work with the occupational therapist on this one. I'll be honest with you, this is definitely more within their scope. We will trial so many different things until we find something that meets that person's sensory needs. It may not be actually holding something, it may be that they need to pick something, right? If that's kind of that movement. So we'll actually find some manipulable where they're actually picking at fabric or something, and we'll give them that. And sometimes we may put a sign in front of them if it's really happening a lot, if they're in their favorite chair, pick, pick the fabric or whatnot, try not to pick your nails, they'll bleed, or something like that. So I know that's a hard one, but just some suggestions that might be helpful.
And Becky, I think you just bring up a good point about how a lot of these interventions require creativity and, looking at the person and having person-centered care and really trying to be willing to have trial and error and try a couple different things until we get to the right solution.
Absolutely, absolutely.
So we have somebody who says they want to know how often a speech language pathologist might meet with patients, and then in your experience, how long will insurance cover appointments?
That's a hard one. So to answer that question, it doesn't have a simple answer because every insurance is different, and in every setting's different too. But let's just say you're living, you're not in the hospital and you're not in like subacute rehabilitation, because that's a whole different, and you're not in home health. Home health is extremely limited. If it's being covered through what's called Medicare Part A, they're just coming to do basic. Can you communicate basic needs? Can you safely walk around? Can you safely swallow, right? Now, if we're looking at, you're going to an outpatient clinic, or right now doing telehealth visits, and working with a speech language pathologist more long-term, or in a memory care community, right, with the therapy team there. Again, it depends on the insurance, but typically once to twice a week, initially, would be a typical frequency. Occasionally people will do bi-weekly, if the care partner schedules are really busy, but usually that consistency is helpful when you're first starting to work with someone. And then it kind of depends on how long it will last. If the first time I'm meeting with people, we usually have so much to work on, right? Because it's the first time we're working together. So we may go a full 3 months of weekly meetings, and I'm documenting to show that progress toward those very specific goals. But then in 6 months, we get back together and there are only 1 or 2 issues where we got to really go back and look at the strategies. And then we might just meet for like 6 sessions and we're able to accomplish that goal. Now, is that the correct way? No, I firmly believe, which is why I am always advocating, that we're looking at research that's looking at what's actually needed. Long-term consistent care, meeting every other week long-term, not this, okay, we're meeting with you and then we're pulling back and then we're meeting with you now. If you're meeting with people long term, you can really catch things before they become a problem, right? As soon as you have warning signs. So that's where the model of insurance reimbursement to me is not aligned with progressive conditions. It is what it is, but definitely check with your insurance provider, and definitely if your SLP is saying there's nothing more I can do for you, and you don't feel like you've really accomplished your goals, talk with them, or maybe try a different SLP within your network. So those are just a couple of tips.
No, I think that's great advice. And I think, sometimes the people will say, well, the speech therapist came out and they said they can't do anything for me and they just stopped working. And so I think we really need to encourage the community that just might not have been the right fit. It's okay to then look for a different speech therapist who might have a little bit more education or training to be able to come in and work with you. Not everyone has the same skill set, and we need to look for those who might have a different skill set in that area. So I'm going to leave you on one last question. We have a student here who says, do you have any tips or words of wisdom for graduate students working with PPA clients?
Oh, wonderful. I'm so glad we have some students here. That's great. And I'm so excited to see your passion for working with people living with PPA. Well, this is kind of a plug that was in my disclosures, but if you're interested in the life participation approach, and I tell all graduate students, it is so important to know about the life participation approach, because it will impact every person that you work with, whether they have PPA or stroke aphasia or any type of FTD or Alzheimer's, because it's a whole model of care that looks at person-centered approaches and life participation. And Aphasia Access is an organization for SLPs and other healthcare providers that the goal is really advocating this approach. And so the more SLPs are being trained in this approach, I think the better equipped we'll be to have a philosophy where we can better help families living with FTDs. So that's such a great question. I'm glad you're here.
I know, and I think that's a perfect note for us to end on today. So, that's all the time we have today. Becky, thank you so much for all of your wisdom and everything that you brought to the table today. I know this resource is going to be one that speech-language pathologists and families and even long-term care communities are going to be able to use for time to come. So thank you. We hope you found this presentation to be informative. We will post the recorded webinar on AFTD's website under News and Events and send out the link as soon as it is available. Thank you for joining us today. Please let us know if you have any comments or questions about today's presentation or about other ways AFTD can assist you moving forward. And be sure to visit our website and make use of the AFTD helpline if you need to. Until next time, have a great day.